Hi, I'm Melissa Russ, and I'd like to talk to you a little bit about nutrition. Did you know that 10% of your body's ability to function well is based on exercise? And another 10% is based on your genetics. But 80% of your body's ability to function well is based on what you eat. It's based on your nutrition, how you digest and absorb your food. Which leads me to a topic that people are heavily interested in these days, and that's leaky gut syndrome or permeable gut. Let me explain a little bit about how it works. When you're still inside your mother, your gut is open and permeable because you receive nutrition through the umbilical cord, and it's supposed to be that way. But once you're born, your gut should close down so that you can retain the nutrition and get the energy to your cells. The way that works is the first pre-milk that you receive after you're born is called colostrum. You receive that the first couple of days until your mother's milk comes in. By that time, the colostrum has helped your gut effectively shut down so that you start to retain nutrition. The mother's milk is easily absorbed at that point, and then between 6 and 12 months old, you begin receiving more solid foods, but you're ready for that. The digestive tract has matured, and you become ready to break down more solid foods, vegetables, proteins, fats. You know, that's different than breast milk, but there's a transition period there. What opens the gut back up is actually a number of things. A trauma can open the gut back up, but foods that your body is not ready to receive can open the gut back up and cause leaky gut syndrome. The symptoms that we see from leaky gut syndrome look like impaired immune system, the inability to learn or learning disabilities, impaired sleep and insomnia, energy issues, all kinds of skin issues, and what looks like allergies. We want to call those allergies. It's a reaction to food that we cannot seem to digest. With open gut, the food and bacteria leach back into the bloodstream and are circulated in a way that cause us to become ill. This sets a bad foundation for our ability to grow and repair, whether it's from a trauma or just growing up as a child. To heal leaky gut syndrome is a real important part of what we do at Transcendental Health prior to wanting to do surgery on someone to repair an issue or to start to remove metals. I always want to work on the digestive system because your nutrition is so important to how you're going to heal. We do that by effectively with some supplements and also beginning to inform the patient on what foods are the best for them. Just because a food is marketed as healthy doesn't mean it's healthy for the individual. Asparagus may be healthy for one person but may be reactive to another person. We can find that out by a blood serum test. There are some easier other saliva tests that we can do on children if we don't want to do something invasive like a blood report. And it gives the parent an idea of how to raise their child, where they're staying on track, they're learning, there's no behavior issues, and they're growing at a rate that seems healthy. With adults, taking control and empowering them to eat the diet that is the best and most effective for them is something that we really put a lot of emphasis on at Transcendental Health. And it allows that person to really gain a different perspective of how they're supposed to feel when they can actually digest the food that they need to turn into energy to regain their health. Thank you for listening today.